Indian COVID variant could spark third wave within weeks, experts fear. The deadly Indian COVID variant could become dominant in the UK in weeks, experts fear. This could spark a third wave of coronavirus, raising fears it could force another lockdown. It has already been identified at least 752 times in the past few days, Public Health England (PHE) has said. This led PHE to confirm that the B1.617.2 strain was a variant of concern. The health authority said the variant appears to be spreading more quickly than two other identified subtypes of the Indian COVID mutation. Scientists believe it is at least as transmissible as the variant first detected in Kent last year. This prompted Professor Paul Hunter, of the Norwich Medical School, University of East Anglia, to voice concerns about its speed of growth. He told The Sun, "I am worried because I think it's become clear in the last week or so that this variant is increasing quite rapidly." At this rate of growth it will only be 3 or 4 weeks before B1.617.2 becomes dominant and case numbers in the UK start to surge again. The Kent variant overtook the original strain of coronavirus from China in a matter of weeks and led to the third lockdown in England last year. Professor Hunter added, "People have said it's not more infectious than the Kent variant, but it's actually already outcompeting it." The Kent variant is in steep decline, more than what's clear from the figures of case numbers. And at some point if this Indian variant continues to increase, we will probably see before the end of this month. If it continues, we will start seeing another surge in late May, early June. That will be predominantly the Indian B.1.617.2 variant. But it's too early to be definite about that. Dr. Deepti Gurdasani, a clinical epidemiologist and senior lecturer at Queen Mary University of London, also said the variant was increasing very rapidly. She told The Guardian, at the current doubling rate it could easily become dominant in London by the end of May or early June. The B1.617.2 variant is one of 3 from India found in the UK in April. It was later labelled a variant of concern by PHE due to it having the ability to spread at least as fast as the Kent variant. The other two variants, B1.617.1 and 11 of B1.617.3, are a step below, categorized as variants under investigation. Boris Johnson has already said the government needs to think very carefully about the public health response. We're doing a huge amount, obviously, to make sure that when we do find outbreaks of the Indian variant that we do surge testing, that we do door-to-door testing, he said. Fay said there was currently insufficient evidence to indicate that any of the variants recently detected in India cause more severe disease or make current vaccines any less effective. Scientists are now carrying out laboratory testing to better understand the impact of the mutations on the behavior of the virus.